Thanks, Isabel. Pre-treatment assessment, education and counselling are an essential part of a speech pathologist's role when managing patients who are undergoing a laryngectomy. Pre-operative education sessions provide the opportunity to give information, assess pre-treatment function levels, discuss the role of key professionals, the timeline for recovery, communication options post-surgery, changes to swallowing function post-surgery, lifestyle changes, and social and emotional support. Laryngectomy patients are required to cope with physical, psychological, and economic changes. Therefore, the counseling phase when managing patients with a laryngectomy is crucial to prepare these patients and their spouses, family, carer, and/or friends for the changes that they are about to encounter and the rehabilitation process that will be undertaken after the operation. Recent literature identifies that laryngectomy patients felt that the information provided to them during the pre-operative counseling sessions were insufficient and inadequate, leaving approximately 50% of patients feeling less than satisfied with the information provided by their speech pathologist during this time. The results obtained from recent studies appear to confirm conclusions drawn in studies that were conducted 20 years ago. For example, Keith et al.'s study indicated that 13% of patients who underwent a laryngectomy stated they were uninformed about the loss of speech and voice and the speech rehabilitation process post-operation, whilst a recent study conducted by Zane and Larson identified that 21% of the laryngectomy patients still felt uninformed about the consequences of the surgery. Overall, recent literature indicates that individuals with a laryngectomy and their families require more information regarding the extent and consequences of the surgery. The need to improve the quality of preoperative counseling has been identified in numerous studies within the past 30 years. Although this has been a common conclusion drawn amongst all studies conducted within this area, there have been little changes to the patient's perspectives or improvements in the quality of the preoperative counseling phase from earlier studies until now. Therefore, the resource was created to assist clinicians with providing a better quality preoperative counseling service. The conclusions drawn from current literature identify specific gaps within the preoperative counseling stage. These gaps were highly considered and incorporated within the laryngectomy information booklet created. For example, communication methods and voicing after a laryngectomy, and the potential long-term impact a laryngectomy may have to the patient's swallow function. Incorporating the information booklet within the preoperative counseling sessions will assist the clinician by providing them with a general structure and guide on how to outline their session, as well as ensure all salient topics about undergoing a laryngectomy will be covered. Good communication with patients has been shown to increase patient satisfaction with healthcare providers, as well as increase compliance with management and assist the patient with emotional adjustments. Providing good quality pre-treatment counseling has been known to reduce the impact that post-surgical changes can have on the individual, ultimately helping to achieve a better quality of life for the laryngectomy patient and their families. As consequences of the surgery, such as loss of voice or changes to their physical appearance, has been adequately discussed to assist in making the rehabilitation process less overwhelming. By providing clients and their families, carers, and/or friends with an information booklet will allow them increased opportunity to absorb the information that has been presented to them prior to the surgery. Moss stated that a potential reason for why some patients and families felt uninformed or that information provided during the preoperative counseling phase was insufficient because when an individual has to hear they have cancer and that it needs to be removed, that is enough for the individual and their families to focus on and prevent them from absorbing any other information. Although it appears to be a plausible rationale for why patients do not remember receiving information, it cannot be the sole reason for the high dissatisfaction rate. Therefore, the information booklet created provides clinicians with a patient-friendly resource that supplements the information provided in the session. It also provides the client with a source of information that they can read to ensure they feel well informed prior to undergoing the surgery. Talia will now give you a detailed overview of our information booklet.